As always, I'm joined by Monroe County Commissioner of Public Health, Dr. Michael Mendoza. Also joining us today is Dr. Robert Mayo, the Chief Medical Officer of Rochester Regional Health, and Dr. Michael Apostolakis, the Chief Medical Officer of U of R Medicine. Let's review where we are with the numbers. Today, we're reporting 1,822 new cases and a 921 seven-day rolling average. Last week, we reported 680 new cases and a 501 seven-day average. So let's just take this in. 1,822 cases versus 680 cases from last week, and a seven-day average that's up 400 more than this point last week. And we don't believe we peaked. We should expect more, and I even think even 2,000 cases a day is what's likely in the next coming days. So what does this all mean? Let's have an honest talk about this. Since day one of the pandemic, my goal, Dr. Mendoza's goal, and the healthcare system's goal has been to keep people alive. The bottom line has been to prevent death. So what can you do to help keep yourself alive? Once again, let's talk bluntly about hospitalizations. As of yesterday in the Finger Lakes area, we had 506 people hospitalized with COVID. That's up 9 people from last week at this time. We've had 129 COVID patients in the ICU. That's down 11 from this point last week. That puts our region at 41.1 hospitalized people per 100,000 residents. That's the highest in New York State, and it's well above the New York State average. The vast majority of COVID patients are unvaccinated. North of 80% of those in the ICU are not vaccinated. 90% of those on ventilators are unvaccinated. So the message is clear. While a lot of you who are watching this right now may be sick, and a lot of us are going to catch the Omicron variant, even if you're vaccinated, but it is unlikely that you will get hospitalized, and even less likely that you will die if you are vaccinated. The vast majority of people who are sick and dying of COVID are not vaccinated. Others are either frail or otherwise health compromised. So what can you do to stay alive and to stay healthy? Vax, boost, mask, and test. People can stay alive if they're vaccinated. The number of people in Monroe County who died from the vaccine is 0. Those that died from COVID is more than 1,600. Vaccine may not keep you from being infected, but it will keep you alive and only rarely sick enough to end up in the hospital. All you have to do is look at the numbers, the facts, and the data, and then make that choice for yourself to protect yourself, protect your family, and protect your community. Vax, boost, mask, and test. There's also some confusion around quarantine guidelines. We have different messages that we're getting from different various levels of government, so I want to be very clear about what Monroe County is following. Here's what we know. The New York State Health Department recommends for those that test positive for COVID, if you are asymptomatic, fully vaccinated, and you wear a high quality, well-fitting mask, and you are an essential worker, you can return to work after isolating for 5 days. This is the guideline that we recommend, and this is the guideline that we will follow in Monroe County. These guidelines make the most sense right now as we work to make sure that our first responders and our essential employees can stay on the job. We need to keep our kids in school, protect our teachers and staff, and we need to keep our economy open, all while carefully managing the spread and keeping people healthy. Finally, we need to keep our hospitals from being overwhelmed with COVID patients and forced delays that delay needed medical care and procedures for others. As I started with, yes, Omicron is spiking and our numbers are way up. This is not a surprise. We've been talking about this for weeks. The Omicron variant is highly contagious. Dr. Mendoza will speak more about that in just a few minutes. We saw this coming and we've been preparing for it. It's why we expanded our testing sites and why we purchased 750,000 test kits and distributed them to schools, the city, towns, and villages. It's why we launched our Vax Boost Mask, Let's Keep Monroe Open campaign. It's why we expanded our vaccine capacity in booster clinics. We have the tools and knowledge to get through this. Now we just have the will to persevere a bit longer. Vax, boost, mask, and test is the way we get through this surge without shutting down our lives again. The way we do this with Vax, boost, and mask, let's keep Monroe open. This message grows in importance in the face of the spike in infections and the continued overcrowding that we see in our hospitals. You'll start to notice the Vax Boost mask posters at your local Wegmans, at Strong and Rochester General locations. Local businesses are starting to post them. And next week, we'll be working with the Chamber of Commerce and their hundreds of members to continue to implement this program and distribute KN95 masks. Since the launch of Vax Boost and Mask, we've seen an increase in residents wearing masks in indoor public places. And I want to thank you for doing that. Remember, the goal here is to keep stores, classrooms, workplace, entertainment venues open, and is to keep us alive and healthy. We can continue our day-to-day lives as close to normal as possible if we support our small businesses, our employers, restaurants, and the workplaces by getting vaccinated, boosted, and wearing a mask indoors, and please take a test. It's the right thing to do. It's the respectful thing to do. And it's what you can do to show your appreciation for those who wait on you, serve you, provide healthcare to you, teach your children, and they work with you. Masking matters. Doctors are recommending wearing stronger, secure masks to help stop the transmission of the Omicron variant. And I want to thank Governor Hochul because of the governor, Monroe County is able to now distribute 330,000 high-grade KN95 masks to frontline and essential workers. So law enforcement, fire, EMS, healthcare workers, teachers, restaurants, service and nonprofit agency employees all interact daily with the public. These masks will help keep them on the job serving their clients and customers. Remember, Vax Boost Mask will keep Monroe open. The masks are being distributed to Rochester Regional Health, URMC, the Greater Rochester Chamber of Commerce, Monroe County School Districts, county employees, the local nonprofit community, local government employees, fire departments, law enforcement, and EMS. An update on the 750,000 COVID rapid tests we purchased and distributed to our schools and the public. Nearly every rapid test has now been given out. It's my hope that people use these before any New Year's gatherings or after close contacts with someone who's tested for COVID. If you do, please remember, fill out the form that we have online to report that home test positive to the Monroe County Department of Health. Monroe County continues to see hosting sites in the city of Rochester and surrounding towns. Visit monroecounty.gov to book your appointment. And an update on the vaccines. More than 510,000 people in Monroe County have completed their vaccine series, and more than 550,000 have had at least one dose. That's a great response, but the work is still not over. I need you to please get the vaccine if you haven't already done so, and please seek out the booster shot and get boosted if you're eligible. The vaccine is the best way to prepare your body for the fight against every strain of COVID. Monroe County continues hosting clinics in Greece, Pittsford, and across the city of Rochester. As I and Dr. Mendoza have long said, kids belong in school with the proper precautions. It truly is the safest place that they can be. So let's all work together. Let's keep our businesses open. Let's keep our schools open. And let's keep ourselves healthy and alive as we enter this new year. And I know that's a lot to throw at you. And when you watch the news, we see a lot of information, a lot of things about case counts. We hear about statistics. We hear about how many test kits have been distributed, how many vaccines. But let's bottom line this and summarize it for the community. There's an awful lot of people who are getting sick. Every day, our numbers continue to go up. Is the vaccine going to protect everyone from getting sick? No. But what the vaccine has done and continues to do is it keeps us alive. It keeps our hospitals functioning. And that is what you can do, every single one of us in Monroe County, to make sure that we come out of this, we enter this new year with as many people alive as we can, is to get vaccinated, get boosted, and to wear your mask. Through all the noise and all the confusion that exists, it's actually very simple. Let's get vaccinated, let's get boosted, and let's stay alive. With that, Dr. Michael Mendoza.
Dr. Mendoza, I think you're on mute.
There we go.
Indeed.
There we go.
I think 2 years into this. Sorry about that. Obviously, a lot has changed since last week, and it is confusing. Our numbers are increasing, guidance is changing, and like before, there is much uncertainty. And given all of that, because we are tired, the temptation to rely entirely on what has worked before is strong. We all rely on patterns and habits to ease our minds of difficult or unwanted tasks. But when it comes to fighting COVID, and especially Omicron, we need to do better than that. This is a different COVID pandemic. different in many ways than the COVID we had in even November or earlier this month. Omicron is different, and for this reason, we need to be thoughtful about what's new without forgetting what we know. Omicron is a new and highly contagious variant of the original COVID virus, according to many experts, sharing the same level of contagiousness as the measles, and much more contagious than even the Delta variant. Omicron is different from the Delta variant, however, in a few important ways. First, it does not appear to cause severe illness, which is reassuring. We won't know for sure because case numbers typically precede other measures of severity by a week or two, but early reports locally and from other parts of the globe are very reassuring. For now, it appears also that our existing tests can detect Omicron, although this is an area of intense research at the moment. Unfortunately, because of how contagious Omicron is, the case numbers are rising at unprecedented levels. So even if a small or smaller proportion of those cases find their way to the hospital, we may still see a substantial impact on individual health and our hospital systems. And no one wants to see this impact our society, our schools, our businesses, or our livelihood any more than it already has. We have been beating the drum for months about all of the things that we can do to beat this pandemic, and I will reiterate them today, but through the lens of where we are in this new stage of the pandemic, fighting a new enemy at a time when we are all tired of all of this and just want to go back to a more normal time. Let me begin by reminding you that no preventive measure is perfect. People still get injured even though they wear a bike helmet or a seatbelt. People still have strokes and heart attacks even while they take their medication. And people still get COVID in spite of the steps that we all take to prevent it. It's not anyone's fault. It's simply the reality when we're fighting a virus like COVID, and especially the case when that virus is as contagious as Omicron. But when we use each of these preventive steps together, they make for a much safer situation, reducing risk where we can, and hopefully giving us the confidence that we have done all that we can do. And at the end of the day, that's all we can do. So first, masking. Masking matters, much more so now than even in early November or December. Delta did not infect boosted individuals nearly as much as Omicron is, nor was it as contagious. So now, whether you are vaccinated or not, whether you are boosted or not, masking will add a layer of protection, and perhaps the most important layer of protection. We want our masks to cover our nose and our mouth with a snug fit. And more so than before, we want it to offer a high level of filtration. N95 and KN95 masks are ideal, but not yet widely available, which is something, as you heard, we are working to change. Cloth masks combined with a paper mask offer nearly the same level of filtration. So if you would like the best level of protection, wearing one of these three types is best. Vaccines. Cases among people who were previously vaccinated are common, especially among unvaccinated people and those who have completed their initial vaccine series and are eligible for their boosters. If you haven't gotten the initial vaccine series or your booster, now is the time. Again, no, the vaccine is not perfect, but we know it will protect you from severe illness and hospitalization, even if you do happen to contract the infection. Third is contact tracing. The purpose of contact tracing is to break the chain of disease transmission. Unfortunately, with Omicron as contagious as it is, and with an incubation period thought to be as short as 2 to 4 days, it is much more challenging than ever, and we are simply not able to reach everyone quickly enough. So if you learn of a positive test in yourself or in a loved one, most importantly, do not panic. You will be okay, and if you need help, help is available. Call your doctor if you feel sick, but please know that the vast majority of cases among vaccinated and boosted individuals will resemble nothing more than a mild cold. Isolate as soon as you can. Stay in a separate area of your home and use a separate bathroom if that is available. If you have to come close to someone in your household, you should both wear a high quality mask when you are together. And as you heard, for now, we are following the New York State Department of Health guidelines of isolation for 10 days, with that exception, as you heard, for people in a critical workforce role to leave isolation only for work at day 5. But for now, if you have a positive test, you should expect to remain in isolation for 10 days. I know many of you are interested in adopting the CDC guidelines, but please note that like the New York State guidelines, testing is not emphasized in either of these guidelines, and I believe it should be. Testing at day 5 will help to identify those who may still be contagious, whether they are vaccinated or not at day 5. So while adopting the CDC guidelines now might have some benefits, it would come at some level of risk. And I realize that there's no risk-free path, but with a holiday only days away and more than the usual number of gatherings on the books, I think it is reasonable for now to hold the course. And finally, if you have COVID, let people who might have been exposed to you know that they should quarantine also for 10 days. As you heard again, we are following the state guidelines, but we will modify this as new information becomes necessary. And finally, testing. Testing with a rapid test at home is the best way to know if you are contagious. So please consider a test if you have symptoms, if you are traveling, or if you will be gathering with others, especially those who might be at higher risk, people who are unvaccinated or who haven't gotten their booster, and people who are older with or without chronic medical conditions. Again, none of these measures alone is 100%, but collectively they are safe and effective steps that we can all take to get through the surge without unduly needing to close anything down. With school reopening next week, I want to urge especially school personnel and teachers to stay safe so that we can have a workforce to send our children to when they go back to school next week. You are as important to our schools as our healthcare workers are to our hospitals. We will find ways to manage the cases among students, but if a school loses its teachers, its maintenance staff, or its bus drivers, the choices will have been made before we even have a chance. So with that, I want to conclude my remarks and hand it over to my colleagues, Dr. Apostolakis and Dr. Mayo.
Thank you, County Executive Bello and Health Commissioner Mendoza. Greetings to Dr. Mayo, and thank you to the media for being here today. Today, we have 134 patients hospitalized at Strong with active COVID, an increase of 12 from 1 week ago. 45 of those patients are in the intensive care unit. 1 year ago at this time, Strong had 174 patients with active COVID, 46 in the intensive care unit. So we are not at last year's peak levels in terms of hospitalizations, but the percentage of patients who are critically ill is higher. It is important to emphasize that the majority of our current patients are unvaccinated. A year ago, vaccines were just becoming available. Today, anyone over the age of 5 can be vaccinated, and anyone who's 16 or older can get a booster shot. We know that vaccines are safe and incredibly effective at preventing serious COVID illness. I also want the public to understand that the unvaccinated patients in our hospital are much younger than patients we saw a year ago. They consider themselves much healthier before becoming sick with COVID. The number of children hospitalized with COVID is small but increasing. Today, we have 9 pediatric patients admitted to our hospital with COVID. 1 is in the intensive care unit. Today, we have 4 pregnant women who were admitted with COVID to our intensive care unit. 2 of those patients are on heart-lung machines to keep them alive. As an intensivist, I care for these patients firsthand. I've spoken to these patients before they went on life support and to their families, and none of them thought that they could get this ill from COVID. Had they known how ill they could get from COVID, they would have chosen to get vaccinated. Most of them wish they could rethink that decision and go back in time and get vaccinated. They can teach us a lesson. Whatever risks you have heard about in relation to the vaccine, the risk of not being vaccinated and getting seriously ill from COVID is far, far greater. The fact that the Omicron variant appears to be less virulent than Delta doesn't change that. So once again, I'm appealing to the public on behalf of the healthcare workers at UR Medicine who are stressed and tired. Use the tools to help prevent this. Use vaccination, booster shots, and wearing good masks in public. They will protect you, protect your family, and make sure your hospitals remain able to care for you and the community. Thank you. Over to you, Dr. Mayo.
Thank you very much, Dr. Apostolakis, Dr. Mendoza, and County Executive Bello. You know, we stand on the eve of a new year. There is much to reflect on over this past year and much for which to look forward to for the coming year. It may feel daunting to imagine entering the third year of this pandemic, which certainly is an austere reality we all face. But in our reflections, let us remember all the wonderful things that have happened. In this past year, all the people who've been vaccinated, the tens of thousands, in fact, the hundreds of thousands of people, as has been quoted here today. Every member of this community has made a personal sacrifice because of this pandemic. Many people have made many personal sacrifices. All of these for the good of the whole, for keeping our community as healthy and as safe as possible, keeping our children in school, learning and growing and progressing in their lives, and doing all that we can to live as full and healthy lives as possible. As you think about this coming year, let's continue to build upon the past successes. As has been mentioned, now is as important a time as ever to be vaccinated. It's never too late to be vaccinated. So those of you who have not yet made this choice, we urge you, we collectively raise our voices to urge you to be vaccinated. The realities of serious illness are very ever present in our hospitals. Rochester Regional Health has 215 active COVID patients today in our hospitals. Many of these patients are in our ICUs and are on ventilators. We are doing all that we can from a medical scientific standpoint to help these patients recover. But it is still ultimately each person's body that will declare its responsiveness to these therapies. This cannot be easily predicted from any given for any given patient. That is why it is so important that each of us take every precaution possible to avoid getting sick and to be vaccinated. So I wish you a happy new year and a happy experience through the vaccination process.